to the information session for the referral screening verification process, also known as RSVP. My name is Smith. I'm the Transition to Community Living Initiative InReach Lead at North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. I'm the project manager for the RSVP project. I'll session with some background information and the purpose of the project. Then State Lead, the TCLI Diversion Lead with DMHDD-SAS, will provide information about the referral process and do a step-by-step demonstration of how to submit a referral using RSVP. The purpose of VP. The Department of Health and Human Services is implementing the referral screening verification process for individuals being considered for admission to an adult care home effective November the 1st of 2018. Change as a result of VP will be replacing the pre-admission screening resident review, or PASRR as you currently know it, for care homes, and to provide a more streamlined and effective process to screen the Transition to Community Living Initiative target populations. Through RSVP, regarding diagnoses, all Medicaid-eligible individuals who are being considered for admission to an adult care home, General Statute 131D-2.4, with the exception of group homes, will require the new RSVP. Eligible individuals requesting personal care services will also require RSVP. These beneficiaries will not be assessed for PCS without a referral screening ID. Again, it's a very important notation to remember. And Carolina NC Medicaid Clinical Policy 3L has been updated to reflect this change. For RSVP, individuals have had a previous PASRR, which is the current process, to the go-live date of the new RSVP, which would be 11/1/2018, for an adult care home to enter a medical or psychiatric hospital, an acute or sub-acute rehabilitation facility, or long-term acute care hospital or medical or psychiatric treatment, and if they return to an ACH after the treatment. These need an additional referral screening through the new RSVP unless there has been a significant change in their psychiatric or medical status. These have a severe mental illness or severe persistent mental illness. All referred individuals who have requested to transfer from one adult care home to another and already have had an ACH PASRR prior to 11/1/2018. They can transfer if they are medically and psychiatrically stable. So who can a referral using the new RSVP? Any referral using the RSVP, which is a difference from the PASRR process. Individual, consumer, or guardian, family members, advocates, providers, hospitals, management entity, managed care organization staff, etc. Does an Indian need to be informed to make the referral using RSVP? If as a guardian that is considered the guardian of the person or a general guardian, but not the guardian of the estate, then they must give consent before making the referral. You will a little bit more about this when Stacy walks you through this demonstration. So how to get a referral? There's two options. There will be URL, and you can see the URL on the screen. Just to remember that this is not accessible until 11/1/2018 for the go-live date. So if you click on it, you won't be able to utilize it. There's also a paper version for to submit a referral, and DHHS will utilize a paper process in addition to the web process screening to ensure that the referrals are completed expeditiously as well as convenient for everyone trying to submit a referral. As a rule, the online tool will utilize a paper document and instructions about how to submit it will be posted online at DHHS website as well as the LME MCO websites prior to 11/1/2018. Who will need or will need to purchase any software? Will we need to install any software to be able to access the RSVP to do referrals? The answer is no. RSVP is a web-based and only requires access to the internet to complete the online referral. The link to submit the referrals is public. Stacy will discuss a little bit more about referral submissions and then do a step-by-step walkthrough of the referral process.
When should referral be completed? Referral completed during hospital admission discharge planning and prior to the admission of a Medicaid-eligible individual into an adult care home. The referral should be completed prior to any PCS assessment. What is submitted? The referral will see a referral submission page that contains a referral ID number. The referral will have the capability to save or print the referral submission that contains the referral ID number using the web browser options. Off date for the current ACH PASRR process. The ACH process will no longer exist for ACH admissions after the RSVP is implemented on 11/1. This is also important to remember that as of 11/1, the current process, again, for ACH admissions will be RSVP. A slight demonstration to walk you through what RSVP will look like in the tool. Again, demo process right now, and once it goes live, there may be some slight changes made to wording, but the quality of the screening will look the same. Access the URL. This is what the screen will look like. At the top, you'll see that it says Referral Screening Verification Process. There's a paragraph at the top that explains the purpose of the referral, as well as a link to the Department of Justice settlement that is on the DHHS website. Anything beyond the web page that actually has a star, actually required documentation or required filled-in information for the tool. So on the first instance, we're going to actually do a referral that is going to come from the hospital. The referral role is the actual individual that is completing the referral. So in this instance, I'm to be an individual that is completing the referral from the hospital. The next is, does the individual being referred have a guardian? As Tamara explained in the prior PowerPoint presentation, there's specific guardianship information. If I'm a person that does have a guard the person, then I would check yes. When yes checked, the box in this area referral that says if the individual has a guardian that is considered a guardian of the person or general guardian, but not the guardian of the state, that guardian must be notified before making the referral. Is the situation and is the case, you check yes. There's a checkbox that says the individual completing the referral has received consent from the guardian of the individual to contact the LME MCO for a diversion screening. If they do not have a guardian, you say check no. This changes slightly. It says if the individual has a guardian that is considered a guardian of the person or general, but not the guardian of the state, you check no, and then check the consent box, saying individual completing the referral has received consent from the individual being referred to contact the LME MCO for a diversion screening. Field is the referrer's name. So I'll type your name if you are the referrer. I'm going to use the name of Minnie Mouse, I'm sorry. Telephone required. That the LME-MCOs, if they need to contact the referrer to gather any further information, have a contact number for the referrer. Email address. This optional information. It's a good idea to put this information if you do have it, because this allows follow up on the referral to contact you other means other than just the phone number if necessary. There's a box down at the bottom that says, remember me for the next time. This is a box that you have to check, but if you're somebody that will be making a referral on a regular basis, what this does is it pre-populates and fills in the refer information so that each time you do a new referral, you don't have to complete the information each time. Moving on to the next screen. And because the box, I went back and changed from a guardian saying yes, or from no to yes. This is going to prompt you again to make the change. So again, I'm going to click, say that I have gotten consent from the guardian, and click next. So check the box that says there is a guardian. It's going to require me to put in the guardian information. And in this, the guardian name is going to be Mickey Mouse. Guardian phone number. We've had to get consent from the guardian, so the guardian will be the person that we're speaking with to gather further information. Once again, email address is optional, but if you do have that information, I would ask that you at least put that information in to give optional contact information. I've clicked, so the screen that we're going to fill out is actually about the individual that you're making the referral for. The name of our individual is going to be Donald Duck. Required, as well as the date of birth for the individual. The individual gender is also required. Her information and guardian information, an individual telephone number is also required. Address is optional in this field as well. Say the name of the facility, hospital, or shelter, or the applicable location that the individual is presently located at the time of the referral. In this instance, we're going to say that this is coming from a community hospital, so we're going to off community hospital. In the facility, you just begin typing the actual facility name. In this instance, again, it's the community hospital. We're going to use Wake Ed Cary Campus is our example. If I was this information and it was coming from a facility, being an adult care home or a licensed DHSR facility, if in the field for name of facility, it will actually start, once you start typing, it'll actually pre-populate and show all of the DHSR licensed facilities that you can choose from. Otherwise, you just simply keep typing in the field and it will type the exact location that you're trying to address. The referral field that's required, in this instance, we're going to have to type in the address. So this, we've typed in an address. I'll show you what it looks like if we're actually going to type in a facility. So if I come back up and I click on facility, we can information, and we will just choose the name. Try to find a facility that actually matches in the search. So if you can see facility, and it also then pre-populates the address location down below as the referral location. To the next page. The next is where you'll document the reason for referral, and this is a required field. That you can choose from. You use each of these individually, or they chosen together. So, for instance, for this example, we're going to choose that it's a mental health referral, and for personal care services as well. Mental health. The next field is for potential mental health diagnoses. Use the box next to mental health, then this field, you have to use one of these required options. So in case we're going to choose that the individual has bipolar II disorder that has been diagnosed. The next is the individual potentially eligible for Medicaid. You have options of yes, no, application pending, have not applied, or is not known, unknown. In this, we're going to say that the individual is Medicaid eligible. If you know, for application pending, it's depending on the information that you have available at that time. Where you would enter the individual's Medicaid number if it's known, or else you might enter the last 4 digits of his or her Social Security number. And then we're going to say that we do have a Medicaid number, and we're going to go ahead and enter it here. You to enter the individual's Medicaid county. Instance, we know that the county is Wake, so begin entering Wake. The drop will pull up, you'll click Wake, and it will automatically pre-populate with the LME MCO name associated with the Medicaid county. We've also given RSVP is not able to take uploaded documents, and so field you're going to type in any type of documentation that you may have for the individual that can assist with the screening process. For instance, if you have a clinical assessment that has been completed, you type in information such as clinical assessment and of the clinical assessment. Information like medications that they have, as other types of health insurance coverage such as Medicare. And that would be helpful for the LME MCOs when they're processing, would be information such as past hospitalizations. The more input here is the more helpful information that LME MCOs can use when processing for transition to community living initiative. Once that takes me to, you're going to verify the information that you've already entered prior to submitting the referral. To make any corrections, you get the back button at the bottom of the page. Otherwise, review the information on the screen. If it's correct, you complete. Once you hit, you'll at the top, there is actually a referral ID that is put onto the page. This is the number that will actually replace in the clinical coverage policy the must ID number that is currently required now. You will this screen or screen using your web browser options. Once completed this, there's options. You can either exit or perform another referral if you have one. I'm as if we're performing another referral just so you can see what that looks like. If you actually do exit, it just exits out of the system and no other further information you need to do. In this case, complete another referral, and it brings back to a brand blank referral screen. If I would have clicked the box at the bottom for refer me for next time, it would actually pre-populate with your previous information regarding the referral being made. So that demonstration that we have for the RSVP, I was listed the contact information. If you have any further additional questions, either contact myself, any questions regarding the RSVP, and my telephone number are listed, or you can email questions about stakeholder trainings or FAQs to Tamara Smith at the address listed on the screen as well. Demonstration. Thanks. Have a great day.